I'm Master Sergeant Bryan Housel, Combat Logistics Battalion 4 Operations Chief from Lakewood, Colorado. Northern Viper is an exercise focused on building the relationships between U.S. Marine and Japanese Ground Self-Defense Force. This exercise further allows us to enhance our warfighting capabilities and interoperability between the two nations' service members and military forces. Really the bulk of the weight and capability of logistics as a warfighting function to the Marine Air Ground Task Force. What that does specifically for CLB-4 is it allows us as a direct support battalion in support of 4th Marine Regiment. As we become an LCE, or a logistics combat element, we grow on bigger capabilities, enhanced medical capabilities like a forward resuscitative surgical system with a shock trauma platoon, bringing Role 2 to the MAGTF. We get greater engineer capability, enhanced utilities capabilities, material handling with heavy equipment, and a lot of bulk fuel capabilities for us too. The LCE is important because whether it's in support of combat operations or humanitarian assistance and disaster relief missions, the LCE brings the bulk of logistics capabilities through transportation, engineering, medical, supply, maintenance. There's a lot of capabilities that we bring forward to enhance all the commitments that the Marine Corps brings to the world. Working with the Japanese is always a genuine privilege for us. Their culture is extremely respectful, and everybody from all ranks is really excited to interact with each other and to share not just our military skills and capabilities together, but really just the individual personalities is really unique and special with the two countries' services coming together here. Really for Northern Viper, we as the LCE, we're able to emphasize a intermediate supply capability, so specifically getting a greater parts block and some other supply class items out here to support the MAGTF in this extended environment in the forward area. So our supply chain matured not just from the supplies, parts, and materials that we brought forward with us into the training area for the exercise, but we actually built a distribution network that went all the way back to mainland Japan and Okinawa. And some of our greatest successes were from point of order to delivery to the customer in 2.5 days. The Marines and sailors that participated in this exercise will truly embody the tip of the spear ideology from their experiences here. Being able to come off of Okinawa and be able to truly demonstrate their capability, enhance their warfighting capability to fight in any climate place.
I'm Ensign Josh Scherrer. I am the officer in charge of the Role 2 here for Northern Viper. So the Role 2, it provides, it's a medical asset that provides advanced trauma support and continuation of emergency treatment from either point of injury or Role 1 treatment. So the Role 2 provides what I mentioned previously, and essentially any surgical intervention that will preserve life, limb, or eyesight. Once that intervention has been completed, we have the capability to hold that patient until we can manage their care to the next echelon of medical care, so the Role 3. In that situation, our ERC team, our en route care team, will provide that treatment to the patient's final destination. So when a patient comes to the Role 2, they're initially going to come to our SDS tent, the shock trauma system tent. That's essentially our version of the ER. Once the patient is stabilized there, they'll go to pre-op, and if the patient does need surgical care, they'll come here to this room, the FRIS, where surgical intervention will happen. After the surgery, they'll go out to post-op, and once done there, they'll go over to our holding ward, where they can be held up to 72 hours. And at that point, once the patient has been held, a coordination of care will occur to the next Role 3, and our en route care team will take them there. If any other side work needs to happen within that time, we have an ancillary crew that can provide lab work, combat stress. We have biomedical technicians that repair all of our equipment if needed. We also have dental capabilities out here with us from 3rd Dental Battalion. Essentially, our motivation to come out here and perform this mission with the JGSDF, you couldn't ask for a better group of professionals. We got everybody from corpsmen to doctors, nurses, clinicians, administrators, everybody out here working alongside our Japanese counterparts. You know, it's beautiful to see. There's certainly challenges working in a cold weather environment. It affects the type of care that we give, especially as it relates to the temperature control. So temperature control the patient once they get here, how we regulate the temperature of our medications, our blood, the type of education that we give to our units out there to help prevent these injuries. The Japanese, the JGSDF, they were awesome to work with. Communication and teamwork on both sides of the house was essential when we were developing our air and ground medevac plans. Being able to go over those plans and actually execute them using both our organic assets and their assets, it was essential. It was great working with all the other units at the LCE together, just seeing how each of the individual units within the LCE work together and provide that LCE force to the MAGTF. It was eye-opening to see how all of us as little gears play into the big machine of things. And then with the JGSDF, the partnership and friendship that we've maintained and will maintain for the future years is essential. Bilateral training exercises like this, helps reinforce what we're capable of.